Welcome to Home's Room. Just like Homeroom, we start off our day getting together with our homies, swapping stories, even a little kiss and tell action. This podcast contains language not suitable for younger listeners, topics about sex and mental health. Discretion is advised. Our views are our own. Let class begin.
Welcome back to Home's Room. I'm here again with a guest, leading sexual medicine physician in the country. Like, that's a big thing right there. He's an expert in the treatment of sexual health for men and women, and a busy man, Dr. Paul Gittens. Thank you for being here.
No, thanks for having me. I feel like we should, like how goes wild, But it's there you go.
Yeah.
But it's a pleasure to be on your show. I've been looking forward to it. I think you're an excellent podcaster, and I'm looking forward to having a really good time tonight.
Awesome. That's a big compliment. I love doing my research, and before we jumped on here, you talked about, you did a little bit of research on us, so that's not an empty compliment. So we really pride ourselves on trying to be authentic. So as long as you enjoy our authenticity, we can't ask for more.
Yeah, no, I agree. I think being honest and being authentic is the way to go.
So you're in the medical field, like I said. You're an expert in sexual health and things like that. So what is it exactly that you do, or what would your title be?
Yeah, so I'm a urologist. So essentially I went to medical school and I did a residency in urology. And urology is essentially the study of kind of the reproductive tract. So most urologists will see men and women, and we really see things from the kidney to the ureter to the bladder and to the sexual organs, really. Most urologists, they focused mostly on prostate cancer and enlarged prostates, etc., for men. But I decided to do a fellowship in sexual health. So I did a fellowship and I studied male infertility. So I studied that. And so I deal with a lot of men that have low sperm counts or have the inability to have children. And so I help them on their journey for that. And on the other end, I treat men and women for sexual dysfunction. So that means anything that can go wrong in the bedroom, I treat, right? So for men, if it's erectile dysfunction, if it's premature ejaculation, if it's pain with ejaculation, if it's testicular pain, if it's pelvic pain, anything that can go wrong, I treat. So in the bedroom. And so I pride myself on that. It's a great field. And for women, same thing. So for women, I treat women that have issues with orgasm, low libido, patients that have pain with sex, just a gambit of things that I love doing and treating in the office.
Yeah. I think that the fact that I don't know how these people keep finding me, or I keep finding these people that, like, they could have stayed the course and done what everybody else does, but instead they decided, there's a gap here, and I want to try and fill that gap because I care about these situations and these people as a whole, and not just, point A or point B, like that, getting them from both. And I think that is, a testament to the world is changing and becoming more, I guess, connected. I don't know what word I want to use, but where people are trying to do more than the bare minimum. And I love that. So
yeah, I mean, when I first started in the field, nobody was interested in sexual medicine, and I would say it was a very few that was interested in sexual medicine and male infertility. Now it's becoming a little more common, where physicians are taking like weekend courses and they're opening up clinics and things like that. But in our practice, we do a deeper dive into sexual function in terms of our workup and how we treat our patients. So, I like to consider myself kind of on the top end of sexual medicine, and one of the thought leaders in the field.
Yeah. Well, from what you said just there, and the stuff I tried to set up with this interview, I hope that we can not only break that down a little bit so everybody can understand it, but I also hope that people branch out, and if they have questions or concerns, they feel more confident in going to somebody. And that's one of the, like, I've had a lot of holistic healers on here that deal with different aspects of that journey, and that's kind of the thing I want to bring across anytime I have somebody that's in a medical or spiritual, or somebody that's trying to help you become the best version of yourself, is that there are less people out there worried about asking the questions, and knowing that there are people actually out there willing to have an honest and open conversation about sex, about your health, and honestly just giving yourself the best quality of life you can have.
Yeah. And I think and part of that is being honest with yourself, and maybe your partner being honest with you. And especially when it comes to sexual health, there's a lot of guys that have some issues with, say, erectile dysfunction or ejaculatory issues, and they keep it to themselves. I have a bunch of guys that instead of going into the bedroom, they'll stay up all night and watch the ball game, so they don't have to deal with kind of some of the problems. So it's important that that patients are truthful with themselves, and they are a little bit vulnerable, because it is some vulnerability, right, to be able to talk to a physician about these problems. It's you have to sort of take it down a notch a little bit and be vulnerable, but be honest. And if you are, then, and you're going to the right physician, then you could be helped. I'm just an internal optimist, and I feel like most people, I would say 98% of people, can be helped if they're going to the right person, if they advocate for themselves.
I 1000% agree with that. So one of the first questions, and this is just purely because of the content that's out there on the internet right now, and the push for like this alpha male stereotype, but I want somebody that actually knows and sees, those tests run, or sees the people coming in that actually have symptoms of, or processes of. But do you agree with the internet's view that testosterone levels are becoming lower in general? And a lot of the content creators say men aren't men like they should be, and it's due to lack of testosterone because of like the containers we eat out of, because the dads are doing a bunch of other stuff and not the manly things. So not eating red meat enough, not doing physical activity, not going to the gym. Do you agree, first off, with the testosterone levels are dropping, but the reasons that exist on the internet right now for why that is?
So in terms of if testosterone levels are dropping, they might be a little bit, but the tests that we're using to test for, and the assays that we're using to test for testosterone are different. They're always changing. And so that's something that we need to keep in mind. Are men becoming less men? I don't know what that means, right? I mean, what is it
Yeah.
becoming a man, right? Do you have to beat on your chest and fight a lion to be a man, or do you have to take care of your family and have a job, and do the things that you enjoy? Is that being a man? And talking to people, or talking about your emotions, is what's more of a man? In terms of testosterone levels, I think that what's out there on testosterone levels are incorrect. I think that people focus on numbers a little bit too much. The first thing that people come to my office and they say, Dr. Gittens, what's the most optimal testosterone level? And I think that the consumer, like I guess some of these clinics, they kind of focus on that number a little bit too much, because if you work with testosterone as much as I do, then we use the numbers as more of a gauge, as opposed to how we treat you, right? Because there's so much more to testosterone than just like a total testosterone number. So I am a firm believer that there is no like correct number for everyone, because everyone has a different level, which is going to make them symptomatically better. right? And so for some guys, that level might be 400 where they feel fantastic. And another guy might be 900 where it feels fantastic, right? Because when we look at the hormone of testosterone, it's not just the hormone. It's all right, how much of the testosterone is being bound in the blood, and when it's being bound, it's not getting into the system. But also, we have these little gloves, right? These gloves are called receptors, and those receptors are things that kind of capture the testosterone, and then it brings it into the brain, the penis, the muscle, and then then the muscle or the organ reads the testosterone in a certain way. And then there's some men where the testosterone receptor is really sensitive, right? And in some men, it's not as sensitive. So, for instance, like for me, if I drink, if we're gonna talk, let's talk about Starbucks or something like that. So if I drink a short cup of coffee, that's all I need for the whole day, right?
Mm-hmm.
Where other guys, they have to drink like a venti coffee, right? For them to feel the same effect. And testosterone is the same way. For some people, they're just more sensitive than others. So when we're focused on these numbers, we're losing the whole picture in general. So it's really important that if your audience is going to go to someone that or if they're going to start testosterone, they go to someone that understands how it works in the body, how it gets absorbed, how it gets bound, and then they can come up with a plan to benefit that person.
I love your example of like a Starbucks, because that's like a sidebar, I guess, but that's another like good example of people not quite understanding that they can only absorb so much. So it doesn't really matter how much you're putting in. If you only absorb so much, your body is going to either jettison the excess, or it's just going to be floating around doing nothing. And with caffeine as an example, like you said, you can get by on just a small cup of coffee, and there's people that have to have like their 3 Red Bulls a day to make that feeling the same. And your health, you know your activity level, there's so many things that play a part in that it always blows my mind that people, like you said, they take the numbers and they focus too much on that number and not what other factors are around. So I think that is exactly what I was hoping you would bring up, and what kind of answer I was hoping to get from you, is that there's so much more to it than that.
Yeah, my patients, they hate me sometimes. I blind them to their numbers, because sometimes if they have an idea of they need to be 1,000, and when we check our hormone levels, it might be a little less. And if they see it's a little less, they become their numbers. Like people can become they can feel great. They can feel great for the month, right? They can feel great for whatever the time period where we're checking their lab. But when they see their labs, they're like, oh, maybe I wasn't feeling so great, and so it's important that that discussion is and that trust is built with a physician that's treating that patient.
Yeah. I again, that's where good doctors, that's where good humans come into play. But in your opinion, what are true signs of low testosterone levels that like might be more, I guess, objectively looked at to say, hey, this may be something I need to go actually get checked out?
Okay. So in terms of signs of low testosterone, there's a couple of signs that we look for, but they do overlap with other things, right? So you can have some mild depression, right?
Mm-hmm.
You can have some erectile difficulties, decreased muscle mass. You can have, if it's really low, you can have some issues with fertility. If it's super low, you can have some problems with like hair and growing hair and things like that. But when you talk about depression, if you talk about decrease kind of like quality of life or vitality, right? So if somebody's depressed, they're going to have some of those symptoms, right? If somebody's not sleeping, they're going to have some of those symptoms. So we have to make sure that we're teasing out testosterone levels and symptoms, and we're differentiating them with other things that could also cause those same symptoms, right? But in general, as I mentioned, some decreased libido, sexually, decrease orgasmic function sexually, decrease erections functionally, and then you have the quality of life things such as like the vitality, the depression, muscle wasting. Those are all some other signs.
Yeah. And sticking with the testosterone thing, last question, I guess, around that particular topic, but does low testosterone affect women?
Oh, of course. Yeah, I actually saw a woman today that had extremely low testosterone because of birth control. So birth control can increase a protein where it binds all of most of a woman's testosterone, their bioavailable testosterone, and that could lead to low libido. It can lead to pain with intercourse. Just as a note that testosterone is not FDA approved for women, but off-label. There are a number of physicians such as myself that may administer it, but under strict supervision as well as consent, that we will do that.
Yeah. Well, again, like I said, that just giving people information here so that they maybe think outside of what everybody's told them or what the internet's telling them. So I appreciate that side note on that as well. But changing gears, you just kind of mentioned it. You saw a woman patient today. So you work with women as well as men. Who or what, I should say, has been the most common thing in women that should be talked about more as far as patients that you see that you don't that there's not enough conversation around?
Yeah, I would say that that's probably two things. I think women that are going through menopause is a big topic. I think that there's a number of women that really suffer after menopause in terms of hot flashes, in terms of pain with intercourse, in terms of low libido, and there's just not a lot of help out there. I have a bunch of physicians that they've seen their OBGYN or their physician, and they say you kind of have to deal with it. This is just a part of life, right? And so those patients, I think, suffer because they feel like if they're not kind of pulling through it or pulling themselves up by their bootstraps, then they're not kind of like a real woman, sort of, right? But I find that those patients, they need help. They're either having pain with intercourse as well as their vaginal health has declined, and so they may be having increased urinary tract infections, etc. So there is help. There's a number of different things that we do. There's hormonal therapy. There's non-hormonal therapy. There's lasers that we use to kind of help with vaginal health. So that's a big population. And another population is my patients that are a lot younger, right? The patients, as I mentioned, those patients that might have been on birth control or might have excess binding protein where they just have low libido and problems with orgasm. And so we help them with that. So the big, there's some big topics on there. There's birth control, there's SSRIs. So SSRIs are selective serotonin reuptake inhibitors. They fall into the category of like Prozac and Paxil, right? They also cause low libido. They also can cause some pain with intercourse and issues with orgasm. So we deal with it all.
Yeah, I think it's one of those, call back to what you said earlier, where you have to be open and honest with yourself, but open and honest with your partner, and vulnerable with your physicians. Where if you're having pain, if things aren't seeming like the best quality of life, and I know for me, I grew up with two medical professional parents, so anytime something hurt, I knew that if I went to them and said, oh, I don't feel good, their first question would be, well, how long have you not felt good? So
Yeah.
it didn't do me any good to just be like, just now. So as soon as I start feeling not good, I need to take note of it so that I have an answer for that question. And when my mom would ask me a question that like I'm embarrassed to tell her about because it's my mom and I'm a boy and I don't want to, like, I had to kind of drop that off to the side because I knew that ultimately the goal was to get help and she would know the best answer. And if she didn't know, then she would ask my dad. If my dad didn't know, then I knew undoubtedly one of them was calling their medical professional friends and saying, "Hey, my son said this. What do you think?" And if I held something back, now it's the help I might get isn't going to be what solves the issue. So I definitely agree with people being open and honest about those things, but also where you were saying, there's probably a whole bunch of things that need to be talked about that just aren't being talked about.
Yeah, I think you're lucky that you had two, parents in the medical profession. I always say to my patients they have to be their own advocate, and you're lucky that you can always just call someone. But I think patients should also have someone that they can talk to. So it's going to take work. I think that there are physicians out there that will slow down their office hours and kind of lean in and allow you to discuss, or the patients to discuss these things. So it's just going to take some time to find someone. If not, maybe a therapist that will give a lending ear. But it's really important that that if there's a problem, that you should have someone to talk to. Like it seems like it's more and more, at least in around here, where just patients don't have primary care providers, and they're like, "Doc, I don't need a primary care provider. I don't need a primary care provider." I tell them you should have one, because you never know when you're gonna get the flu, right? And it's gonna be so much easier to call someone and say, "Listen, I'm not feeling well," as opposed to going through Google and trying to find somebody at that time and then waiting another month, right? So we always want to have someone that's kind of in our back pocket that we can kind of talk to, and it takes a little work, but it's definitely worth it.
Yeah. So sticking on the topic for the women listeners out there, medicine has come a long way, and what are some of the most positive advantages at if I can speak, advances in obstetrics and gynecology? Like what are some of the like advancements that are making it better and less of a
So I mean, I think in terms of obstetrics and gynecology, I don't focus on that area. It's really mostly like sexual medicine when it comes to what I focus on. But when you look at how the visits are beforehand, and genetic testing that they can do before the baby's born, I think that's gone a long way in terms of really being able to kind of look at chromosomes and looking at what could go wrong, what's this, what could be happening. I think is a field that's even getting more advanced. In terms of sexual medicine, there's a number of things that we use. There's lasers that we use now. So I treat a lot of women that have breast cancer and that have sexual function. And for those women, because they have breast cancer and it might be estrogen positive, then we can't give them estrogen to help with their sexual problems. So there's a number of lasers that are out there that can treat the vagina without any hormones. So it's great.
Mm-hmm.
And I think that's definitely an advancement. It's an option that's out there for women. For women that are interested in some vaginal tightening or something like that, there's lasers for that, and there's treatments for that. There are a few medications that came out that are FDA approved for sexual function for women. That's an improvement. We didn't have anything over the last since we've been in medicine, and over the last maybe 5 to 6 years, there's been at least 2 medications that have been approved that are FDA approved that we can use for sexual medicine for women, whereas before we were using other medications in its place. So
Yeah.
I think the field is moving in the right direction, and I hope it continues to do that.
Medicines in general being supplemented for like its purpose is this, but it can help with that. I think knowing that there's starting to be more of a two-sided coin as opposed to a one size fits all kind of situation is one of the things that I've noticed and seen just based off of things that are available in home or over the counter now that didn't used to be. So I think that's like you said, it's hopefully going to continue to go that way and be, ever growing. But we tend to be a 60-40 with more women listening to our podcast. I don't know why that happened or how that happened. I'm completely okay with it. But can you tell us what's one important thing women should know about their health and be taken seriously?
I think that in general, I think that, diet and exercise, I always go back to lifestyle. That's always so important because, sexual function and health, they kind of go hand in hand, right? And so that's really important. Obviously, mental health is also really important. So finding ways to decompress, finding outlets, exercise is a good way to do that, or just, walking in the park or playing Scrabble,
Yeah.
whatever it takes to kind of allow yourself to kind of decompress and reduce stress, I think is really important for sexual health as well as just overall wellness.
Yeah. And that answer was so diplomatic. I was going to ask, what would that same question be answered for our male listeners? But it was such a diplomatic answer. I don't know that. I don't know what else would you add to that for men?
I don't, there's so much, there's so much sexism in medicine. And I really try to be conscious about, what I say, because I think it's unfair, for women. We have so many things that are approved for men and not enough for women in sexual function. I think that when a woman comes in and says she's got low libido, instead of kind of doing a workup for her, we say it's because the kids are driving you crazy, or because the stress, and we don't say that for men. For men, we try to treat them, and we don't talk about what's going on socially. So I look at my male patients and my female patients, and I look at them sort of in the same way, right? Because I think that we all need lifestyle changes. I think we should all undergo a proper treatment for sexual function, regardless of how many kids you have, regardless of what. For me, it doesn't matter. And I think that I just hate that bias. And like for instance, in my field, there's not many urologists that are trained in sexual medicine or that do this, that actually treat men and women, right?
Yeah.
And when people found out, you go to these meetings, and I go to a lot of sexual medicine meetings, and we have the American Urological Association, and guys find out that they're like, oh, you treat women as well. And like, how can you? And the thing is always, how do you like stand to listen to these women for so long? Because they're always, talking so much or whatever. I'm like, that's like the most sexist thing I've ever heard.
Yeah.
Because like, our guys talk or women talk. It's just, I think things have to change when it comes to how we kind of treat our patients in this field.
Yeah. I work currently with kids with autism and special needs, school settings. And I was doing a training, and we got asked the question, like, how would you treat, a person with this gender, or, that's different gendered, or that's, different race, or, whatever the differences that make people individuals. How would you change how you approach the situation with those people? And sitting there, I just kind of like let everybody talk, and they all looked at me because I was quiet, and like, well, what do you think? I was like, I think it's a trick question, because we shouldn't be treating them that much differently at all. We should be approaching it with the mindset that these are issues that everybody faces. How does this individual need me to address this situation? Because all of these situations are, made up of thousands of choices that have led us to this point, and all of those choices are different for everybody. And one of the guys running the training stopped, and he perked his ear up. He said, trick question, huh? And I was like, I mean, yeah, I just know that, like, if I was going to change something that I did because somebody's a different race than me, that's not going to help them. That's going to make them look at me like, what are you doing? That doesn't seem right. This seems like now my defenses are up. And afterwards, he turned around and he addressed like everybody in the room, and he was like, I heard some good answers. One answer I heard, and then he tells the story about what I said, and he was like, it is a trick question, because ultimately people are going to need to be disarmed, and if you're trying to be something you're not, if you're approaching them with, you know, kid gloves because of this, or because they're a woman or not, they're going to see that and maybe not tell you everything they need to tell you because they don't feel comfortable. So your job as, you know, the person closest to them in this moment, you should be trying to see them as the individual and uplift them in that. So
No,
I
I
just
totally agree. Totally agree. I think that I think you have to be a good listener. I think that for me, you're right. So for me, for all my guys, in terms of workup, if they're men or women, you know, we do the same thing every time in terms of the workup, right? Because I don't want to miss anything. So if you're 18 years old or if you're 70 years old, we're doing a full workup, right? I do think that we do have to pay attention a little bit to like some cultural things. Like for instance, I spent some time doing urology in Japan, and so when you're out with your friends in like at a bar, so you pour your friend a drink and they pour you a drink, you never pour your own drink. Or if you're going to take a business card from someone, you take it with two hands and you don't just throw it in your pocket. You respect their business card because we know it's part of them, right? So I think there are some things that we have to pay attention to, because there are some differences in culture and races. I don't think that should influence what we're doing, but I think we have to be aware and we have to be able to communicate that, so we're more welcoming to those people, right?
Mhm.
In a way. But I think that in terms of the medical workup, a guy that's going to come into my office, of course I'm checking their testosterone. I don't care, I don't care how old you are, right? We're going to check it. If you're 18, doesn't mean that your testosterone is high. I'm not going to neglect you. I'm not going to think it's more psychological. We're going to look for organic causes as well. We're going to see if there's some issues with your blood flow, because it could be. I've seen everything. And so I think it's so important that we do that, but also that we try to meet them where they are, I guess.
Yeah, meet them where they are is definitely, almost a bannerable saying that people need to kind of take more notice of, in my opinion. So you deal with erectile dysfunction and you help men regain their natural erections. What does that look like, and why is the way that you help out different?
So I think the way that we go about it, I think that, as I mentioned, we're doing a full workup. We do ultrasounds of the penis to kind of see what's going on with their blood flow, right? There's a couple of different things that could be going on. Is there scarring in the penis? Is the penis not getting enough blood flow? Is it leaking out? Do they have Peyronie's disease? All these things are really important. And then we combine like our nerve testing, we combine our Doppler, which is our ultrasound, we combine our hormones, and then also just being able to listen to the patient in terms of what they are expecting out of it. Like are they single, right? Because I'm not going to give the same treatment maybe to a single guy that we may give to someone that has a long-term relationship, right? So are they dating, and are they eating when they're all these little things we're gathering, and then the treatments that we're giving are geared towards all these things, all the summary of all the things that we come up with. And our treatments are pretty advanced in terms of what we're doing, like if it's core wave therapy, if it's Botox, if it's PRP. We use only quality things. Like I would never treat a patient. My rule is like I would never treat a patient with something that I wouldn't give to myself, right?
Uh-huh.
And so everybody's got a different treatment plan. Everyone, right? No one's exactly the same, because nobody comes in exactly with the same problems, right? And our protocols are tested, and our success rates are really, really high.
Good. I think when I was doing my research on you and seeing how individualistic you were, and even the information that's out there was something that like kind of made me like, I definitely want to have a conversation with somebody that is looking at all of those situations in the context of the individual versus the blanket statement, because the blanket statement is how we've gotten to where we've gotten as a society, especially around certain topics. And, because of those blanket statements, there's a lot of shame around some of them. And premature ejaculation is one of those, like, it's, don't talk about it, it's over there, the age old, it happens to everybody, it's a thing, and you still feel bad about it. So in this age, especially in social media age, what are some of the ways that you treat premature ejaculation?
Yeah. So once again, it starts with talking to the patient. It's all right. So have you had it all your life? Is it something that you developed later, right? Is it, we do nerve testing. So is your penis too sensitive? Is that one of the reasons? Is it situational? Does it only happen if you're having sex in the back of a car as opposed to if you're having sex at home, right? What were you before? So were you like 15 minutes before and now you're 30 seconds? What does it mean to you? So maybe you were 20 minutes before and lasting 20 minutes, and now you're lasting 15 minutes, and then you think that's premature ejaculation. So all these things have to be kind of gathered. All this information, all this data has to be gathered, and then we start talking about how we're going to treat the person. There's a number of different things that we do, especially after we find things out. It could be hormonal, so we may have to treat with hormones. If there's some nerve issues, we may have to treat with that. A number of things, some of the common treatments for premature ejaculation is that there's nothing FDA approved for premature ejaculation, by the way. There's nothing that's out there. So oftentimes you'll use like the side effects of SSRIs, right? So selective reuptake inhibitors. And for those types of medications that can delay ejaculation, sometimes we will mix that with a little bit of Cialis and Viagra. That can help accentuate the area. Sometimes we'll use Botox or filler in the penis for certain individuals, which is off-label, but we'll still use it. Sometimes we use like TENS units also that kind of trick the brain into allowing the guy to have better or last a little longer in the bedroom or with masturbation or whatever they're doing with the penis.
Yeah. Do you, I know what like sex therapists say about it, but is there a medical standard for what premature ejaculation is?
Yeah.
Like
So
time frame or?
And before I answer that, like you mentioned, you said sex therapists, and I use sex therapists a lot, right? And I think they're really important to this whole to the whole field. And so I think sex therapists are really important. I haven't mentioned that because I'm just kind of focusing on the medical portion of it, but there are other ends of it, such as sex therapy, as well as like pelvic floor physical therapy, which can also help. So those are some other things that we add in that I didn't really mention. So the question of, how long is or how short is too short, right? And so there are definitions of premature ejaculation. The more common number that we're looking at is about 2 minutes. It's less than 2 minutes, and it has to bother the patient. So it has to bother that person. So for instance, if you're enjoying intercourse with a partner and you ejaculated in 30 seconds and both of you guys were happy and there's no complaints, then that's not really premature ejaculation. That's having a good time, right? But if you are having intercourse and you're at that point and you're disappointed, you want it to last longer, then that's what we're looking for, as well as kind of under 2 minutes. But everybody's a little different. Some guys, they feel like they were at a certain point and now they're at like 3 minutes, and for them it's premature ejaculation. So it's really a case by case, but 2 minutes is usually the number that we're looking for.
Yeah. I think that's kind of the same general explanation that I've heard other places. So I'm glad that correlates, and it's not, you'll hear this thing from these people or this thing from that, like unified facts on that being, it has to bother the patient. it has to
Yeah.
bother you. Like that's the big component to that, I think, that people kind of miss out on.
And definitely, like, if you look at the average times, they're, they differ between like cultures and everything, but it's about 5 to 7 minutes is about the average time of a person having, intercourse. But obviously that differs between individuals.
Yeah. So I meant to ask you this to make sure I could talk about it before. If not, we can edit this out. Fun
All
of recording ahead of time. But as a spokesperson for the Extensor, what made you believe in that pump? And I have a promise to my listeners that, I would never put a guest in front of them who's just here to sell a product or just here to, like, get the word out about something, not necessarily something that will truly impact their lives, like the information you've already provided.
Yeah, of course. Yeah, and I am a spokesman for the company, and everybody should know that. But I would use it anyway, right? And we've been using pumps for a really long time. We use it as part of a rehab. We were using it as part of like erectile dysfunction rehab. It's pumps have been used for a long time for prostate cancer patients, especially guys that have lost length.
Did not know that.
Right. And when you look at these studies, we see that, if you add pumps to whatever regimen you're doing, if it's using Viagra with pumps, if you're using injection with pumps with prostate cancer patients, they're going to get a better outcome, right? So we know that that pump is helping. And so I've been using it for ED, but I have also been using it for kind of general health for guys that are coming in with either minor ED or guys that just want to be able to kind of maximize their sexual function. I do believe that getting blood flow to the penis and kind of stretching the penis and guys being aware of their penis is really important. And as I mentioned, there's a couple studies that that show that, especially with prostate cancer patients.
Yeah. So do people still have that like 90s version of a hydro pump in their minds when you first bring the idea to them, like that back of a magazine, snake oil salesman-y kind of thing?
Yeah, the pumps have gone through a lot of different alterations through the years. Like if you look at some of the medieval things, like, pumps have been around since like the late 1800s. And so as you can imagine, like things have changed since that time. I don't think a pump is a bad word. I don't think that men should be nervous or scared about pumps. I think it's something that in my practice, we make it part of a routine of things that they're doing. If they're, like I said, if they're coming in for ED or if they're trying to be proactive about their sexual health, we do introduce pumps. The good thing about pumps is that there's hardly any side effects if you do it correctly. So if you're on medications, if you're whatever else is going on in your life, I mean, you can use a pump, unless there are some contraindications, like for instance, like sickle cell or guys that are having like intermittent priapism, those are erections lasting too long. We don't recommend it to those patients, but if you're doing it correctly, then it's not going to do any harm. Obviously we're all guys, and the guys out there, they think more is better, and so some guys are pumping their penis and keeping it inflated for like 20 minutes and stretching it, and we know that's not the correct way to do it. The good thing about the hydro pump or the exerciser, is that you can use it in the shower, and so it's something that we all do, right? It's not taking a lot of time. That's why guys like it, because they're just in the shower. What else you do in the shower? You can sing in the shower, you can soap off, and then you can use kind of a pump. So they kind of make it as part of their routine. So that's why I like it in particular.
Yeah. You answered my next question, which was going to be how little or how much of a side effect is there from it. And it's one of those things, like to the research that I've done there, if you're using it correctly, similar to like a inversion table, if you're using it correctly for the recommended amount of time, for the recommended situations, there's not a ton that adversely affects you. And I think that that's good. Would you consider it homeopathic? kind of, because it's not.
I would consider it as kind of more treatment, more kind of like rehab for some guys,
Yeah.
treatment for other guys, preventative for other guys. That's how I would kind of. It depends on why we're using it. We have different protocols for different for guys that have different issues. Like we have protocols for guys that have Peyronie's. We have protocols for guys that have issues after prostate cancer. We have a different protocol if you have ED. We have a different protocol if some guys are just interested in kind of just getting ahead of things and just focused on their erectile health. So there's different protocols for each. The biggest thing is not using it too long, because that's when guys get into trouble, and when they overextend. It's a little harder to do that with the exerciser just because it's of the hydro pump, and we see that mostly with the pneumatic pump, but you can also overdo it with the hydro pump. You just have to make sure that you're doing it correctly,
Yeah.
and you're not doing it for too long. I mean, when you look at oxygenation of the tissue in the penis, if you're pumping up too long, and when they check a blood gas, that means they check how much oxygen's in the tissue. The longer it's up, the less oxygen you have, the less healthy your penis is. So we don't want to extend it for more than like 20 or so minutes.
Yeah. And that's good following of directions and usage. Like all things, using it as it is intended is probably going to be the best.
But it doesn't matter. I have so many men that I'll talk to guys for like 15 minutes. This is how you use the pump. This is how you place it on, and like, don't use it. This is the protocol. And they'll come back to, 3 weeks later. They're like, oh, I thought you said to just pump it as hard as I can for as long as I can. I'm like, did you not listen to what I said? So it's like, we hear what we want to hear sometimes, but it is part of, in my practice, it is part of the regimen of what I do, and in my opinion, it really helps our guys.
Yeah. So last thing before we get to the this or that, to anyone who's shamed or afraid or worried about coming to see someone like you, what encouragement do you tell them now, or do you send their way as you have the airwaves in their ear?
Well, I think that most guys, they kind of have to go through their thing. It's like, there's guys that they wait like a year, and they go on the internet and they try, like, all these pills and these homeopathic remedies. They go to the gas station. But I think it's kind of like, you have to, I kind of think of it like the steps of, like, beating alcoholism, sort of. You have to kind of go through those steps, and you have to at some point say, like, I have a problem, and I want it to be fixed. And that step is different for everyone. I think that people just have to be honest with themselves, and and look around in their relationship, if it's hurting their relationship, or if it's just psychologically bothering them. And I think those are the men that are going to come in, right? I think those are the men that have some incentive to come in. But there's guys like me all over all over the country, that it doesn't have to be a urologist or a sexual medicine physician. Sometimes it's just nice to be able to talk to someone, right? And then finding the resources to get to see an expert like myself.
Yeah. So I will say, if you are concerned, find somebody to talk to you. And that's a good, I don't even call it a first step, because that's, to get to that point, you've already gone through a ton of steps. So finding that person is definitely important. But what's also important is answering the this or that questions. Are you ready?
Oh man, I don't know if I'm ready for this. I gotta I gotta warm up or something like that. Let me go run a lap and come back.
I promise I won't be too hard on you. So this first question is, going through medical school and all the training again, knowing that this is, where you're headed, or a different path with a different but equally important outcome.
I love what I do, right? I think I have the best job in the world. I honestly do. And I don't think many people can say that. And so I'm fortunate to be able to say that. I get to help people on so many different levels. I had a nurse practitioner that came into my office, and she was working for a little bit, and she said, like, it's so embarrassing. I tell my friends that, all they think I do is just, fix penises all day. And I told her, like, listen, that's not what you do. You're fixing lives. Like, you're
Yeah.
fixing self-esteem. You're fixing confidence in our men and our women. It's not just about like the penis and the vagina. It's so much more than just that. And I think that we need to just, in my mind, like, it's the penis, vagina. It's like the arm. It's but what are we fixing? We're fixing that person, I think, as a whole. And so that's important. Would I do something else? I love medicine. I love medicine. I think medicine is, for me, it's kind of my calling. Would I be happy doing something else? I mean, I'm the kind of guy that'd be happy doing like anything. Like,
Yeah.
I love
Yeah.
medicine, but I love my field in particular. So I would say that for sure I wouldn't want to do anything else. This is it for me.
Yeah.
After this, I don't know what's next, and just kind of sit around and do nothing.
Yeah. Yeah. All right. I like that answer, especially because like I kind of gave you the rope-a-dope setup where I was like, I could tell just by looking into you that you love what you do and you're passionate about it. So the answer to that question was, no matter, like, unless there was some crazy thing that I could not have known about, I figured that would be your answer. But the next one, and this one is probably going to put you on the spot the most. The most difficult male patient or the most difficult female patient?
So my most difficult couple is a guy that has premature ejaculation, or some guys, they have some difficulty actually. If we're talking about a couple that's heterosexual, a person that maybe ejaculates before they get into the vagina, if we're talking about penile vaginal sex, and a woman that has delayed orgasm. So this is a
Ooh.
woman that takes a long time to orgasm. Very, very difficult. Why? Because there's a lot going on there, right? So sometimes my female patient will say, "Oh, he's being selfish," right?
Yeah.
And my male patient will say that she's not being considerate enough. This is a problem that's happening to me. I have no control over it. So I kind of switched it around a little bit, and that's a very difficult couple.
Yeah.
So there you have it. Can I go with that answer?
Yeah, that I accept that one. I did. You got me on that one. I will accept that one, and I give you some praises there. So our last one. You've been all over like media, news, magazine, radio, podcasts. So you're stuck on an island, and the only way you can get off the island is knocking out 10 appearances on one of those platforms. So it's either going to be a news outlet or a magazine or a radio show or a podcast. You got to knock out 10 appearances on one of those back to back to back to back. What are you going to choose? What are you just going to torture yourself with for a while?
So can I go on your show 10 times?
Yeah,
Because
that
if
is
if I could do that, we're good, right?
yeah.
We are good.
Yeah.
I don't know, it's a tough question. I think that in terms of like print, I think print is valuable in some respects, but I think it's very short-lived, right?
Mhm.
So I think that it's somewhat difficult for print. I do like print. I don't love print so much just because of that aspect. But although I do have patients that have seen me in like Philadelphia Magazine or something like that, they rip out the page, put it in their pocket, and then 2 months later they somehow wash their jeans and they're like, "Oh, I need to call this guy." So
Yeah.
that's interesting. I think that podcasts are great as well. I think that it really allows me to sit down and talk and I think and really get a good message across. I hope, I really hope that that's what I'm giving all your listeners, is a good message and a positive message.
Mhm.
So I think that's really helpful. I think when you do media, like TV, you have about 30 seconds sometimes, and you have your points that you really want to get across, and you can't really explain them.
Mhm.
So, I'm going to go with the podcast. I'm going with that. I'm going with
All
that
right.
because I like to talk. I love my field. I love to talk about my field, and I think it gives me more opportunity to do that.
Yeah, I will accept that answer, and I'm gonna say you're gonna make it off the island because you had a good time doing it, and you're leaving with more of a vacation feel than like I was trapped here. If you're gonna do 10 podcasts back to back,
So we got 9 more. You and me, we got 9 more podcasts. We got to
yeah,
knock this out.
yeah, apparently. But I appreciate you answering those questions. I appreciate you being here. If people wanted to look you up and see more about what you do and maybe see what information is out there, how would they do that?
So you can go to at Dr. Gittens on Instagram. I'm not great on TikToks, working on that a little bit.
Yeah.
My website is rockwellcenters.com, and so we're located in Philadelphia, New York, and in the Poconos, right outside the Poconos up in northern Pennsylvania. So that's where I'm located. Really easy to find. You just have to go in one of those cities and just yell my name, and I'll come running.
I love it. All of that will be listed in the show notes, and I hope that one person uses the audio note feature that we have in our show notes to just like yell your name. That'd be hilarious.
That would be great.
But thank you for being here. I hope you had a good time. I hope people truly resonate with the message of like it's a whole experience changing thing to go see somebody like you, where you're not just focused on one thing or this thing or that thing. It's trying to make every part of what you're dealing with the best quality of life for you.
Yeah, thanks for having me. It's been a lot of fun.
The bell is about to ring. If you want to drop us a voice message or simply ask a question, you can do that by clicking the link in the show notes below. Be sure to leave us a 5-star review. It helps more people find us. Theme music by Kinsey. More music available on Spotify. Remember, every day is a class. Go learn something.